Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Good morning. Seizure actually it is a sudden alteration of behavior due to temporary change of electrical functioning of the brain. And normally brain continuously generates tiny electrical impulses in an orderly pattern. If it becomes not in an orderly pattern, hyperexcitation or hyperstimulation from certain focus of the brain, certain areas of the brain, that can lead on to seizures.
What is epilepsy?
Actually, epilepsy means it's a neurological condition or a disorder where a person has two or more unprovoked seizures. Unprovoked seizures has to be the in the definition of epilepsy, and that occurs more than 24 hours apart. If you have more than two seizures which are unprovoked in more than 24 hours apart, you define it as epilepsy.
What are the different types of seizures and do they affect people differently?
Yes. Actually, to the public, seizure is only one thing, that is involuntary movements of the limbs. But seizures are different types. They are actually classified into generalized tonic clonic seizures or generalized tonic seizures or generalized clonic seizures. Basically, the other type of seizure is a focal seizure or a partial seizure. And other types are also there where you have atonic seizures, where the patient will fall suddenly with loss of consciousness. Otherwise, you call it as drop attacks. Otherwise, you can have myoclonic seizures or infantile spasms or bilateral tonic clonic seizures or even febrile seizures following a high episode of high fever. Fever episode can provoke seizure. So there are a lot of types of seizures, not only one type of seizure which the general public is aware.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Predominantly epilepsy, there may not be any cause, but there are certain conditions which can produce epilepsy, especially uh, about half of the patients, adult patients with epilepsy, you will not find any specific cause. But on the other half, common causes include any brain diseases like brain hemorrhages or due to brain infections like meningitis, encephalitis, or due to the brain abscess. These are all infective causes as a result of infections affecting the brain. Then also you can have it can be associated with the head injuries, trauma to the head, then any vascular diseases of the brain like arteriovenous malformations, we call it as AVMs, or cavernomas, where the blood vessels will enlarge or the blood vessels may be entangled. So such conditions present with seizures, especially in early childhood. And then certain other conditions like alcohol intake or drug abuse can also produce seizures. Also, certain biochemical abnormalities like hypoglycemia, that is, decrease in the blood sugar level, or even hyperglycemia, can produce seizures. And certain brain tumors, the presentation is seizures. Very important. One of the important causes of seizure is brain tumors. Especially these sort of seizures appear at a later date. You call it as rather than presenting at the early childhood, it presents the later age. That you call it as late onset seizures. Always a late onset seizure is a concern. You have to investigate, you have to evaluate such conditions.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Symptoms of epilepsy or seizure, they can vary, but common signs of seizures include sudden episodic movements, jerky movements of the upper and lower limbs, or involving one limb or on the one side or on the both sides, associated with loss of consciousness. That is a key factor. There will be loss of consciousness associated with, and there will be staring into the space or confusion or even sudden fear or strange feeling. And some people may shake in just one part of their body. Other symptoms include stomach upset, changes in the body temperature, changes in the taste, changes in the smell, etc. Such varied symptomatology or various types of presentations are there in seizures.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
That's a very good question. Unfortunately, epilepsy has been misunderstood for a long period of time. Historically, people don't realize that epilepsy is a neurological condition and myths developed around it. And seizures can look frightening, and so people may react with fear or even avoidance, which leads to stigma. A lack of awareness about epilepsy can contribute to stigma and discrimination. It can also make some people uncomfortable to talk about their own epilepsy, even when they want to or they need to. And there are several myths associated with seizure or epilepsy. Like all people with epilepsy, they may lose consciousness and have uh, continuous or continuous episodes of seizures in their life. Also, epilepsy is a life sentence. That is not correct, and it is a mental illness. Many people believe it is a mental illness because some people may make unusual noises. They may behave oddly when having a
Yeah.
seizure. That is one type of presentation of seizure rather than a jerky movement of the limbs. And another thing is that we should not restrain a person having an episode of seizure. These are all certain myths. Seizure, seizure, when it happens, better not to restrain the person. And many a time I have seen people restraining the person, holding their heads, holding their limbs, and this is not going to arrest the seizure. That electrical activity has to stop. Then only these
Yes.
involuntary jerky movements will stop. And certain people, the another myth is that you should put something in the person's mouth to stop them swallowing their tongue. These are all not what to say. It is physically impossible for a person to swallow his own tongue. So don't put like that anything into the mouth to prevent swallowing the tongue and all. Certain people I have seen they give some iron objects in their hands so that the seizure episode will get arrested. So by the time you search for an iron episode, iron piece, and to make it fit into the hand of that convulsing person, the seizure electrical activity may be subsiding, and so the seizure will be stopping at that moment. So people will think because of the iron rod only that seizure has stopped. So these are all certain myths.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
These triggers vary from person to person, but common ones include the missing the sleep. So better don't to deprive the sleep for these patients who are having or who are a non-epileptic patient. And the high stress levels has to be avoided. They have to take food in the regular time, avoid episodes of infections or treat the episodes of infection properly. If there's a high fever, you take medications to control the high fever. Then flashing lights, all these things are triggering factors. Try to avoid such triggering factors and missing the dose of seizure medications if a patient is already on an anticonvulsant for seizure. And for women, especially hormonal changes can produce an episode of seizure, especially during the periods of their menstrual cycles, and etc.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
They have to understand that it is not a disease which is not controlled very easily, depending upon the basic cause for the seizure. If there is a basic cause for the seizure, you treat that basic cause, like any vascular malformation, which I have told previously, any abnormal developments, any cortical dysplasias, any diseases affecting the development of the brain. There are various such things which can produce seizures. So if there is something diagnosed, treat that rather than treating with the medications to control seizures. If there is a cause, treat that cause. Then the seizure will get controlled. If there is no cause, then you have to control your lifestyle modifications. There are certain lifestyle modifications like what I have told you earlier. Take proper medications regularly, avoid sleep deprivation, and their stressful periods periods in their life has to be taken care of. Any period of inflammation, any period of episodes of fever, all these things has to be taken care of.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. Uh, Actually, when you have a seizure, you will not be aware. So that comes all of a sudden. So basically, we cannot tell a particular person to take any care during an episode of seizure. But the person who is attending or the person who are the caregivers, they can take some care. That is the only thing we can advise, not to the patient, not only to the caregivers. So if you see a person convulsing, ease them to the ground if they appear to be falling. That is one thing the caregivers can do, and turn him gently to one side, and so that his mouth is positioned downwards to the ground, so that he will not aspirate the saliva and other. And, take care to clean particular person to prevent injury. Any sharp kept away, it has to be cleared away. And also you can pad the sharp corners of the table in your house. If a patient is having frequent seizures, and you can loosen the clothes around the head and neck to get any sort of preventing the hypoxia by making it tightening during the episode of seizure. And you can also watch his breathing properly during the episode of seizure, and look into the face, whether the face is becoming bluish. That means he's having some sort of aspiration, and he is going to hypoxia. So he has to be taken care of. He has to be taken to the hospital. Not all seizures requires hospitalization. Since certain conditions you can make out, and you can properly guide the particular person accordingly. And also, if it is a child, take care more, and prevent the child from falling, because rather than the adult, these children's an episode of seizure, they will fall, and many a time these children will be brought to the hospital with head injuries and all. Don't try to prevent the movement of the convulsing patient, like the hands or the heads. They'll be turning the head to one side, and don't try to prevent all those things. It will produce more injury. It will go on, it will take its own time. The convulsion will settle by its own time only, whatever you do.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Remember, with the right treatment, many people with epilepsy can manage their conditions well, and they can lead their lives normally. Being aware of the triggers, practicing healthy habits, and having support make a big difference to these people. And remember, we are not alone. There is a community of support out there.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.